Now I invite Dr. Krishna Prasad Kudlu. He is the Medical Director of Prasad Nedralaya Group of Hospitals, Member Scientific Committee AIOS, and Editor Proceedings 2023. He is an excellent cataract and refractive surgeon. He will be talking about SMILE and beyond recent advances in refractive surgery.
Thank you, Dr. Rashmi, and thanks again for including me this wonderful instruction course. Thanks, Aisha, and all the senior consultant, my dear friends from Kerala. So I'll be talking about the SMILE and future. I don't have financial interest for this particular talk. So as we all know that laser refractive surgery has evolved in like a full circle. It started with surface ablation, then later on we started doing LASIK, then later on we doing a customized wavefront guided treatment, then again we are doing femtolasic, then SMILE, then again what Aisha told about, people are started doing more and more now surface ablation. People think that it has got more advantages. So coming to the Relics SMILE, it is a combines of a femtosecond technology with a high precision lenticle extraction, aiming at providing minimally invasive refractive correction. Basically, it's a flapless procedure. So advantage with this Visumax femtosecond system, because of it has got a high pulse repetition rate, so the short procedure time, then the low and very stable laser energy that gives a excellent cut quality also, and very good incision size. Then as we all know that always Zeiss provides with a very good microscope, so the depth of accuracy is pretty good. So coming to the corneal interface design, that they made in such a way that it eliminates almost most of the artifacts, minimum discomfort to the patient. Basically, it's a one-step docking procedure. And nowadays, even it has got automatic centration also. Coming to the contact lens, what we use in this Visumax is more towards as a shape of the cornea. So it gives a minimal applanation with a very low suction pressure. So the advantage of with this femtosecond laser is very minimal IOP increase. So you can the lot of advantage for the patient, and also there is no vision loss during the suction. So basically a refractive lenticle is created in the intact cornea, which is removed through the small incision. So single step procedure, due to that very early visual recovery. This is about the machine. So about the incision, you can do from 1 to 4 mm. Beginners, I always tell them to start with 4 mm. They can come down up to 2.5. Even I have done up to 1 mm incision also. So a lot of studies shows that better biomechanical stability compared to the femtolasic. So as I already said that it's a soft and safe suction, so you need not have to worry about that. There is no noise at all, and also less post-operative red eye. Basically, very easy to maintain this machine, so also patient can get back to their work very immediately. Excuse me, the procedure. Can you? Yeah, thank you. So this is about the procedure. Normally, it starts with the lenticle cut, then with the side cut, then with the cap cut, then with the incision of 4 mm. So normally first identifying the different layers are very important. First you identify the superficial layer, then you identify the deeper layer, then you dissect the cornea, something called a windshield wiper movement. Now once you open this deeper layer, dissect in similar kind, make sure that the lenticle is free, then you can take out with the help of any forceps and put it over the cornea to see for the integrity of the lenticule. I'll just show you, take you just a couple of, will you play this video if you don't mind? Just not take much time. When time is over, Rashmi, please tell me, I'll stop that. Will you stop the music? So normally this procedure is, I myself being a surgeon, I explain to the patient, I sit with them how exactly he has to behave during the procedure. So once you tell that how exactly you have to behave, then put the patient under the microscope, then optimal 1 or 2 drops of anesthetic drop is more than sufficient. If you put more, sometimes epithelium may loosen up. Then always being a surgeon, I myself check the parameters in the machine, make sure that it is the same patient data has been entered. Once it is done, then machine start calibrating for that particular patient. Once this is over, proper draping and application of the speculum also very important. Make sure that there is no eyelashes coming in on the way. If you are having eyelashes, sometimes you may have problem. That area may not have any treatment at all. So adequate wash of the ocular surface and the fornix is very, very important. Make sure that conjunctiva is fully dry, but cornea always you should keep a semi-moist. If you keep cornea too dry, then you may have some black spots. Head positioning also very, very important. The patient with a longer nose, always you have to tilt towards the opposite side. Make sure that you will have a proper laser treatment during that time. Connecting the appropriate size cone also very important. Patient with a always take the cone from your right hand, plug into the machine, and then you can hold for right eye, hold it in a right hand, go to the slot, then lift a bit, you will hear a click noise. That means the machine will start calibrating for that particular cone. White to white lesser than 12 mm, always nowadays we are taking smaller size cone. Then in such cases you apply it only 80 to 90% more than sufficient. Only white to white more than 12, then you take medium size cone, there you have to do 100% application. Then I will not be showing about the flex and all. This is will take more time. Can you run the video? Can you run, please? Yeah. Okay, I will not show the complication because of the permitted of time. So these are the advantage with the relic smile. Less energy on the cornea when you compare with the femtal ASIC. So especially it is very good for high myopia, better results, higher stability of the treatment. So lesser induction of the spherical aberration. Very important, larger effective optical zone. So lot of study shows that it has got a higher biomechanical strength. So chances of ectasia is much lesser. There are hardly few ectasias in the smile in the last so many years. So there are some issues with the Visumax 500. One is the cyclotorsion compensation. Second one is still they are not come with the hyperopic correction. And of course, astigmatism was treating astigmatism was a problem, and also centration issues also. This has been overcome by this Visumax 800. Now they are come with the cyclotorsion compensation. Soon they are coming with hyperopic treatment, faster performance, smart robotic assistant, and reduced laser time. Of course, it is digitally connected to the total Zeiss workflow. So compared to the femtal ASIC, always better vision quality, larger effective optical zone, and lesser induced spherical aberration. So always, since it's a very expensive machine, you have to market it in a big way only. Always you should promote it as it's a new way to correct a refractive error, not as a new concept. So communicate that it is not a new technique, but is much more it is an accurate, predictable, and safer treatment. So how we normally promote in our center, basically it's a bladeless, flapless, all femtosecond laser procedure, which has been a laser technology awarded a Nobel Prize in 2018, which is also FDA approved. So different way you can market this machine. So smile must be promoted as a new way to correct a refractive error, not as a new concept. Because as the concept of reshaping the cornea to correct the refractive error has been there for more than 2 decades. So take home message, I am a true proponent of this refractive technology and has been tremendously benefited to my center. Probably our center is the only one center in coastal Karnataka having this treatment. Till that I have done thousands of smile surgery. It has been a sweet ride for me. Thank you.
Thank you, sir, for that explained presentation on smile.